This year, Dash, I am presenting two abstracts, and one of them is around the relationship of MGUS, the precursor to myeloma, and the risk of thrombotic events. So I'm part of the iStopMM study, the Iceland Screens, Treats, or Prevents Multiple Myeloma study, which is a population-based screening study for MGUS ongoing in Iceland. And we have now screened just over half the total Icelandic population over 40, 75,422 individuals. And we're doing this in order to investigate the potential benefits and the potential harms of screening with regards to multiple myeloma and so on. However, another thing that we're looking into is the relationship of MGUS and disease. So MGUS is the precursor of myeloma, and it's asymptomatic. But actually, we know that in some cases, MGUS can lead to disease which is not myeloma, for example, kidney disease, and prior studies have shown that there's an increased risk of thrombosis. However, prior studies are not built on screened cohorts. They are built on cohorts of people with MGUS who show up to the doctor for something else, for example, arthritis or heart disease, and someone tests them for myeloma or amyloidosis, and they find MGUS. And when you compare those type of people to a control population, you will find more diseases in that group, which is not necessarily due to the MGUS itself. And that's why we're looking into this in this screened cohort. So we did is that we used the data from the iStop study, and we connected to healthcare outcomes and diagnoses made in the Icelandic healthcare system through extensive registries that are available in Iceland. And we actually see that people have an increased risk of thrombosis even when we look at it in a screened cohort like this. So we see that those who have MGUS have about 1.3-fold increased risk of venous thrombosis, that blood clots in the legs or lungs, but not an increased risk of arterial thrombosis like strokes or heart attack. And that's contrary to prior findings, but we are confirming that there is an increased risk of venous thrombosis in this high quality cohort. Now, a second analysis we did showed that actually this increased risk of thrombosis was not associated with the concentration of the M protein. So the M protein, the monoclonal immunoglobulins in MGUS, is the sort of main biomarker of the disease, of how far along it is. And many have thought that an increased thrombosis may be due to, risk of thrombosis may be due to M protein bulk or the disease activity, but we find that there is no relationship there. So our hypothesis now is that there may be some people who have an M protein that can bind to some sort of self-antigen or something like that is pro-thrombotic, leading to thrombosis. And our next steps are into looking into identifying a subgroup or a potential subgroup within the MGUS population that has an increased thrombotic risk, where we may be able to prevent thrombosis. Obviously, thrombotic events are often, are of course, very serious health events. And if we can prevent them, I think we do some real good, and that's what we're looking into.